Here she is.
Calvin.
All right. Hello. How are you doing?
I I am doing great. I like your hat.
Thank you very much. Thank you. Thank you. You know, actually, prior to coming on here, I was like trying to switch in between two separate hats, and I just went with this one. I felt like
I think you picked
thinking
right.
about it. Thank you. Dr. Rowe, do you want to go ahead and introduce yourself to my audience?
Yeah, sure,
Yeah.
Kelvin. Thank you so much.
Yes,
My
ma'am.
name is Charlotte Roll. I'm an adult infectious disease physician down in Orlando, Florida. And I'm mostly a researcher. I research like everything related to HIV treatment, prevention, cure, and also the other STIs. So anything related to sex,
Yeah.
Kelvin,
Yes.
I'm
Yeah. Yeah.
all over it. I'm really into that.
Awesome. Yeah. Yeah. Yes. So, I am from Columbia, South Carolina, and it was news to me that Columbia, South Carolina was one of the six metro cities with the highest HIV rate. And I've been spreading that information ever since I found out about it.
Yeah.
And, ever since I found out about it, I've been noticing there's been billboards around the city letting people know, right? So my question is to you is where does where you live matter? Because we know it's like know your zip and know your reasons, not risks, reasons, right?
Love
So
that.
yes, 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 ma'am, yes, ma'am. So does where you live matter and why?
Absolutely, Kelvin. Absolutely. And you know what? South Carolina has been on our radar for a while now, right? Because like the HIV rates there like have been like slowly climbing over the years. And like you said, I think in the most recent HIV surveillance report, the numbers kind of tipped over and
Yeah,
put, Charleston and Columbia on the map, like, and got everyone's attention. And I'm glad that you're seeing those billboards everywhere because that means your public health officials care about that,
yeah,
Kelvin,
yeah,
and they're trying to, educate the local public. So I think that's awesome, by the way. But your zip absolutely matters. Like, I think a lot of people think that their reason
yeah,
to acquire HIV is only related to their behavior, right? It's like only related to what is going on in their bedroom. And that's just like not the
yeah,
case, And I just came off a great discussion with Ashley Cobb, who's at Sex with Ashley. And she got it right. It was a great analogy. When you live in a city where there's a lot of new HIV and a lot of existing
yeah,
HIV, your chances of encountering someone with HIV is just higher, right? It doesn't matter what your behavior are. You could have like one partner or you could have 100 partners. Where you live compared to South Dakota, that one partner is at a higher risk of being someone who's living with HIV, And
yeah,
so
yeah, yeah,
people really have to take into account like epidemiology. It's like a concept that I think like the layperson like doesn't think about and may find it a little hard to understand, but it's just a pure numbers game, Kelvin. The more HIV around you, the more likely you are to encounter it, regardless of what's going on in your bedroom.
yeah, yeah, of course. So we obviously know. So there's a higher chance, but there's good news because there's a thing called PrEP, right? So to, so so tell me what what PrEP options are available and and how do they differ from per person to person?
Yeah, sure. So we have two main forms of PrEP available, Calvin. We have a daily oral pill,
Okay.
right? There's two daily oral pills that are approved for PrEP and in different populations. And then we also have an injectable form of PrEP. And that's kind of cool because, a daily oral pill sounds super easy, Calvin, but like, let's face it, it's like really hard to like take a daily medicine for something that you have,
It is.
much less
Yeah.
take a daily medicine for something that you don't have,
Yeah.
right?
Yeah.
Like,
Yeah.
I mean, women get advice to take birth control to prevent, quote unquote, unwanted pregnancies. And we still can't even do that. Most of us like struggle with that. So, like,
Yeah.
a daily oral pill, like, yeah, that's awesome. We were glad when we got that out there. But we've
Yeah.
had that since 2012, Kelvin.
Oh
And people
wow.
still were not on PrEP. And so clearly other options, right, were
Yeah.
needed. So now there's an injectable form of PrEP, as few as 6 injections a year, Kelvin. It's every 2 months. You get it
Okay.
at your healthcare provider's office, and it is highly effective at
Yes.
preventing HIV through sexual acquisition. So we're super excited about that. That's a newer option for us, and all of us are working together to try and figure that out and get that out to as many people that need it and want it. So we have some options. We do.
Yeah. So we're here to talk about HIV stigma, which I think is very, very important, especially in the heterosexual community, right?
Yeah.
So what are the most common misconceptions and myths about PrEP that you have, seen, especially when it comes to heterosexual men? Because, a lot of us, a lot of heterosexual men think that PrEP isn't for them, or like they don't want to do it. So, tell me a little bit about that.
Yeah, and I think it is some stigma, but there's also like some marketing issues as well, in terms of like who
Yeah.
PrEP was initially marketed towards. And I will, as a part of the ID community, I'll take some blame for that. Like, we didn't do a good
Yeah.
job of making sure, I
Yeah.
feel like, everyone knew that PrEP was for them, right? And so
Yeah.
that was our bad. I'll take that. But in terms of misconceptions, especially among heterosexual men, I feel like when someone is taking PrEP, they may be labeled as someone living with HIV.
For sure.
Or, especially among heterosexual men, taking PrEP means that you're gay or bisexual. Like, that's by far and large, right? Like the biggest myth, I think, amongst heterosexual men when it comes to PrEP. And it's funny because as I'm sitting here thinking, because I have in our clinic, we have about 1,200 patients on PrEP. That's a pretty large PrEP clinic.
Yeah.
Calvin and me personally, I don't have none of my PrEP patients are heterosexual men. Not a single one.
Wow.
I
So
know.
do you feel like most heterosexual men feel like a sense of shame, or like a sense of like let me stay away from that because that's not for me, like a sense of that in a way?
Yeah,
Yeah.
absolutely. I think that PrEP, we know when it first came out, was marketed towards the LGBTQ community, and that's how
Yeah.
a lot still remember it. Even in 2025, that's still how a lot of people remember it. And it really sucks,
Yeah.
Kelvin, because in the most recent surveillance report, like almost 3,000 new cases of HIV in this country occurred among heterosexual men, right? Like, and so
Wow.
that's still, and that's out of a total denominator of like 37,000. So we're still talking like just under 10% of new cases in this country are among heterosexual men. That is clearly a community that is obviously in need of additional HIV prevention efforts, but yet
Yeah.
PrEP is not seen as being for them. And I just think that that's a great disservice to that community.
Yeah. Because I noticed when you talked about that with Ashley, and you said, um, correct me if I'm wrong, but you said that a lot of the HIV cases within women have nothing to do with the woman's behavior; it has to do with the men's behavior, right?
Yeah,
Yeah.
it
So
definitely.
all you guys out there watching, whether you're heterosexual or not, you need to get on PrEP, especially if you're out here being sexually active and living your best life.
I
You know what
agree.
I mean?
Calvin,
Yes.
sex is fun. Like, sex is a lot of fun, right?
Yeah.
That's why people are doing it. And so I feel like people have this tool available to make that fun also as safe
Yeah.
as it possibly can be. And so, like, why not? Like, why wouldn't you do that for yourself, you know?
Yeah. Of course. Yeah. So, what are some of the steps to somebody getting PrEP? Because I feel like with the heterosexual men, it's like they want to be secretive about it, or they want anybody to know, right? So, what's
Yeah.
the best way for someone to go about getting PrEP?
Yeah, sure. So I think, and I'll say this, and I stand by it, Kelvin. I'm gonna stand 10 toes down on it. I really think that PrEP is a part of primary care, right? Like, it's
Yeah,
a
for
preventative
sure.
strategy intended to keep someone as healthy as possible. That is the whole purpose of primary care. I think it sucks that people
Yeah.
have to come to me, an infectious disease specialist, just to get PrEP. Like, there's something
Mhm.
wrong with that. And so I think we have not done a very good job of decentralizing PrEP, right? PrEP is still in the hands of ID doctors. Who wants to go to an ID doctor? Like, PrEP
For
should be
sure.
offered by primary care. PrEP for women should be offered in the OBGYN office. Like, these are just things that should be happening
Yeah.
that are not happening. So primary care is a good place to start, but I acknowledge that a lot of primary care is not offering PrEP, right? So then what does someone do, Kelvin? We do have a tool called the PrEP Locator, and I know that you guys have been making sure that people know about the Swiper tool that was developed by Vindico, which is a great bite-sized tool, a lot of good information about PrEP, but also has a link to the PrEP Locator if anyone wants to know how to find that. And the PrEP Locator is really cool, Kelvin. Like, you put in your zip code and everyone who's offering PrEP pops up. And the PrEP Locator also tells you about whether they serve only insured patients, whether they serve uninsured patients. There's like a lot of good information on the PrEP Locator website. So I think that's a great resource for people who don't know where to start or like who don't have a primary care doctor.
Yeah, and for a lot of people that may be ignorant about the steps and process to get it, when you ask for it, do you have to disclose how many sexual partners you have, or do you have to do? Because I feel like, you know, a lot of heterosexual men, you know, they just don't know, right? And they're kind of like scared. I have to tell everybody I have sex with this person. Do you know what I mean? So yeah,
absolutely. And you know what, Kelvin? I mean, that's an interesting question. I feel like in most PrEP assessments in the healthcare setting, people are going to be asked about their sexual behaviors. I don't think it's right for me to sit here and tell your audience, no, you should not expect those kinds of questions at a PrEP appointment. You should expect those questions. But I think my point is that if you're sitting in front of a provider that you don't feel comfortable answering those questions to, that's not like the right provider for you. Like, you should go somewhere else, you know, because if there is something about that provider that you don't feel comfortable about, like, they also haven't done their job, Kelvin, at like making you feel comfortable and meeting you where you're at, you know. And so I definitely think it's a problem. On the other hand, you can say you respectfully decline to answer those questions, but you still want PrEP, and that's not the wrong answer either.
Yeah. Awesome. Well, Dr. Roll, I know you have to go, but thank you so much for answering all those wonderful questions, and hopefully a lot of my audience, you know, got some information, especially for the heterosexual community, because y'all men need to get it together.
Okay.
Because if you didn't hear her, she said the majority of women's HIV status depend on how y'all behave.
Thank you, Kelvin. Yeah. Say it louder for the people in the back.
Yes.
Okay.
So get your life right. Stop being ashamed. Go to your primary doctor and go get PrEP.
Love that.
You know what I'm saying? Yeah. Awesome. Yes. Yeah. So right now you are going to go join Koya, right? And your conversation with her is going to be about communicating with doctors about HIV prevention, right?
Yes.
So everybody go over there to Koya and join her. Dr. Roll, thank you so much. It was a pleasure chatting with you, and you're amazing, and keep up the amazing work.
Thank you so much. Take care, Kelvin.